Establishing and maintaining a patent airway is one of the most important skills that an EMT must master. We've discussed maintaining patency with airway adjuncts in another lesson. In this video, we are going to review clearing the airway utilizing suction. Due to the risk of hypoxia, the amount of time that you suction your patient should be strictly limited. Adults should not be suctioned for longer than 15 seconds. Pediatric patients shouldn't be suctioned for longer than 10 seconds. And infants should not be suctioned for longer than 5 seconds at a time. Instead of solely relying on suction to clear your patient's airway, be sure to position the patient in a way that facilitates natural drainage, such as the recovery position, whenever possible. If secretions remain after suctioning for the maximum amount of time, you need to ventilate the patient for 2 minutes before suctioning again. Don't forget, for large amounts of secretions, you can use the suction tubing without a catheter attached to clear the volume more quickly. The first part of effective suctioning is ensuring that your equipment is in working order. To test the suction unit, clamp the tubing while looking at the vacuum power indicator. An effective suction unit should reach a vacuum power level of at least 300 millimeters of mercury. Be sure to test your suction units at the beginning of every shift. When suctioning a patient, begin by selecting and measuring your catheter. A suction catheter is measured the same way that an OPA is measured, from the corner of the mouth to the ear canal. Place your finger on the catheter to mark the appropriate length so that you don't suction too deep. The suction tubing should be measured the same way if you are using it without a catheter attached, as previously mentioned. Suctioning beyond the measured length can have negative consequences. Stimulation of the gag reflex is one, which will increase the risk of aspiration. Another possible negative side effect of suctioning the oropharynx too deeply is provoking a vasovagal response. This will cause the patient's blood pressure and heart rate to drop. Vagus nerve stimulation is especially concerning with pediatric patients, who already tend to become bradycardic while in respiratory failure, and could be pushed into cardiac arrest. Prime the suction tubing by sucking up a small amount of water or saline. This will help prevent clogging. If your tubing does become clogged, simply flush the line with more water or saline. Insert the catheter without suction. Once you have reached the desired area, apply suction and move the catheter in a circular or figure-8 pattern. Maintain suction until the catheter has been fully withdrawn from the patient.